Good afternoon. I'm Steve Rehorst with the Watertown Police Department Public Information Officer. Welcome everyone for joining us here today. I do have one announcement before we begin here. Today at 4 p.m., the Salvation Army, in conjunction with Watertown Community Cares, is going to be hosting a food distribution at the Boys and Girls Club in Watertown. Vehicles are able to line up starting from Highway 81 on Arrow Avenue, and they're going to be directed to go east to 9th Street, and from there they're going to turn north to the Boys and Girls Club. There's going to be no entrance available from 3rd Avenue, and nobody's going to be allowed to line up before 4 p.m. The event will start right at 4 and will go until resources allow, until they're handing out all the food. So again, that's going to start at 4, start at Highway 81 and Arrow Avenue and go east to 9th Street. This afternoon, we have with us today Mayor Sarah Karen is going to speak, as well as Dr. Senna from Prairie Lakes. And then we have Chris Silken, who's the Executive Director of the Watertown Development Company. So with that, I'll turn it over to Mayor Karen.
Thank you. Good afternoon. Our COVID numbers in Cottington County today have gone up 1 for a total of 6 cases now here. The state numbers went up to 165 cases, which is 36 new cases, I believe, still at 2 deaths in our state. Our community is pulling together to slow down the spread of the virus, but we do expect to see these numbers rise. Lots of people are volunteering, which is great. We've had several volunteers to sew masks, and now we are getting requests also to sew protective gowns for the medical providers to put over their clothing. If you're willing to volunteer to donate materials or sew gowns, please call or visit 211 and select Health and Welfare. You may also call the police department and ask for Captain Ellis, and he'll get you connected up. You can volunteer for any other service as well. It doesn't just have to be for that. People are confused about the golf course remaining open. The park board applied a test to each facility to make decisions about whether to close them or leave them open. We want people to be able to exercise for their physical and mental well-being, so in general, open areas are available for people to use. But for the facilities, the test was, can you participate there without violating the 6-foot social distance requirement or touching something someone else has touched? And can you do it in an open area with fewer than 10 people? If yes, then the city's leaving that facility open. If no, we're closing. So we feel that this is possible at the golf course, and if it turns out that people are not able to maintain that social distance and are touching things that they're prohibited from touching, such as the flag, then we will have to close the golf course. But for now, we're going to try and leave it open. But this may change as we learn more. Word is out that the city will not be moving forward with the acquisition of the bakery land for the ice arena, and I would like to address that. First of all, there has been no council action yet. The committee has not had a chance to discuss this with the full city council. So it's premature to discuss this right now. I can say that I have directed all of the city departments to press pause on their major expenses until we know more about how this crisis will affect our local economy and especially how it will affect our city revenues. The city was under a time constraint to make a decision on the land, and based upon the current financial uncertainty due to the COVID-19 crisis, any large expenditure at this time would not be prudent or responsible. I reiterate, at this time. I'm sure that's behind the committee's decision, whatever it is. The council will likely discuss this at the council meeting on Monday, April 6th. I would like to finish on a happy note. I was just notified by the Strong Towns organization that Watertown has won the contest for the strongest town title. And this is fantastic news for us. Our name will get out all over the place. People will be curious about our town and wanting to visit here and maybe move here. We won because we meet the requirements. The first principle of Strong Towns organization for being a strong town is that we have strong citizens or engaged people who care. Our COVID response is proof of this. We absolutely meet this requirement for being a strong town. So congratulations to all of us. Folks, we are living through some pretty scary times. There's a lot of uncertainty. Please try to accept that uncertainty as our new reality, at least for now. Don't be upset by this. Instead, be inspired to find new ways to feel close to your loved ones. After all, we're all in this together. We will get through it. Stay home whenever you can and stay healthy. And now I would like to introduce Dr. Senna.
Hello to the people of Watertown and the folks out here. Thank you for having me. I guess I'll start with kind of giving my overall medical opinion and assessment of the situation that we're in. It goes back to some of the comments the mayor just shared about at this time we have proof that we are bending this curve. I am here because I am the final common pathway for folks who get sick and don't get better, as my role as a pulmonary and critical care physician at the hospital. I don't want to meet you there. I'd like to meet you in the community or maybe in my clinic. But because of the strong leadership we have in this community, as well as the strong community members, we are doing a great job to bend this curve down. Now with curbing the infections, we are at a much less likely position to overwhelm our medical facilities here in the state and in our community. With that, however, comes economic hardship, and that is also shared by medical professionals in this town. I don't have specific numbers, but what I could share with you is anecdotally, numbers of clinic physicians are down tremendously. So we are all in this with the folks who have storefronts on Main Street. Speaking about symptoms of COVID and what they are, we've all heard the fever, cough are the two most specific. There's increasing evidence, mounting evidence that there's pre-symptomatic or asymptomatic transmission, and that is something that is concerning, and medical officials are debating how to handle in these cases. What I can tell you is that we all need to abide by our strict social distancing, hand hygiene, not gathering in groups of more than 10. That is proven to be effective, as we are seeing in the current alterations of the curves of numbers of cases. People have the desire to help in this community, and that is fantastic, and I think it's wonderful to allow community members to contribute by making masks and gowns. It at least gives us something to do and a way that we can feel that we can contribute. So keep it coming. I don't have very many prepared remarks, and I guess I'd like to kind of leave it there for now, but I'm happy to address any questions at the end. I'll turn it over. Thank you.
Good afternoon. Thanks for taking the time to allow us to bring everybody up to speed on the disaster revolving loan fund that the Watertown Development Company, along with partners, City of Watertown, municipal utilities, local lenders here in Watertown, and as most recent, a generous gift from T. Denny Sanford in the amount of $200,000 to help us get this fund started. The fund is now over $500,000, and we are taking applications. You can find applications online at watertownworks.com/relief, and from there it has program guidelines and then a downloadable application that you can fill out. It also has contact information, where to call, and email with questions. Brief overview of the loan program. It's a 0% interest revolving loan fund program. Loan amounts range from $3,000 per month, or $3,000 all the way up to $9,000, and monthly payments are deferred for 90 days from the day you take the loan to hopefully get us through to when businesses can open up again. This loan was not meant to be the magic or silver bullet to stop everything. We're using it as a tool to get us through to when SBA and other programs are available for small business and other businesses in town. On the small business side, our best recommendation right now would be to contact your local lender and also work with your accountant, as those are awaiting final rules, and a lot of those programs will be administered through your local bank. I will also be available for questions should there be any after this. Thank you.
All right, thank you, Mayor Karen, Dr. Senna, and Executive Director Chris Silken. At this time, we'll open it up for any questions that the media may have.
The question for the mayor.
Go ahead.
Mayor, this is Troy at KXLG. I know it's premature, but there's some discussion that the ice arena project may be done. I know that that's premature yet, but there's other big projects that are on the city's agenda, such as the downtown park, the Bramble Park Zoo building. What's the state of those projects?
Okay, we're not stopping projects which are already in progress at this time. We're going forward with the animal care facility at the zoo, and the downtown park isn't, we don't have a construction project for that, and nothing is canceled. Everything is just put on hold for now until we know more. So this is not the end of the ice arena, not by a long shot. We're just pressing pause.
Mayor Mike from KWAT. I was on a conference call with Governor Noem here just a bit ago, and she talked about how South Dakotans are flattening the curve, pushing the peak further and further out. Today she specifically mentioned maybe a peak in July or perhaps even August. And I know I asked you last week when these businesses that have been closed due to the emergency ordinance would be allowed to reopen. And you, I believe, mentioned that it would be when we reach that peak and cases are on the decline. If that doesn't happen until July or even August, as the governor is suggesting today, what happens to these businesses?
I wish I had a crystal ball. I can't imagine what it's going to be like. The only thing I can say is we are all in this together, and we're taking this day by day and trying to make the best choice for our communities and for our states and for our country. There will be economic damage. There's no doubt about it. And the main thing, though, that we're looking for is to maintain control over the numbers at our healthcare facilities. And if we are not in control, if we have more people than we have the ability to treat, there's no way we'll be backing off on our controls. If we have that under control and we can back off a little bit and it doesn't send the numbers screeching up where we can't manage, then maybe we'll be able to back off. But that remains to be seen. And if we don't ever get numbers larger than we're seeing, and we're already in August, and we've had these small numbers the entire time, then yeah, we probably would be able to back off a little bit. But I really don't expect that that will be the case. That is not normally what happens with this disease progression. So we do expect our numbers to rise sharply sooner or later. And because they haven't doesn't mean they won't. And I hope that when that happens, we will not be inundating our medical professionals to the point where we have to make terrible decisions on people's health. We want to be able to treat everyone properly. That's our goal. And so we're just taking this one day at a time like everybody else, and just hoping for the best for everything. But life and safety has to come before economics.
Mayor, when will you get, I assume that Watertown gets monthly reports from Peer on on your tax collections, or do you get that without having to get peer involved?
We do get those numbers from the state, and they're delayed. So we don't have any numbers that reflect what's going on with the COVID situation at all yet.
Going to be my follow-up question. When do you expect to get some, I'll call it post-COVID tax return numbers that will give you some sense of what kind of a financial blow the city is taking here?
Well, I think that the first month, which will be fully showing COVID activity, will be the March numbers, and we won't have those till halfway through April at the earliest. So we're out a couple weeks probably from being able to see that. Any other questions?
Yeah, a question for Dr. Sen. Sorry if I'm mispronouncing that name.
Yes, sir.
Yeah, you mentioned that there's proof that the curve is being bent. Is that a local level, or are you talking statewide? Lee?
I'm talking statewide. To my knowledge, I don't have any local projections specific to our county, our service area, and just based on this is not scientific. This is anecdotal. Knowing where cases have been in the state and adjacent to our service area in the western part of Minnesota, I, to be honest, was starting to expect to see more cases by the end of last week, and I did not see that. That was something that I was happy to see. So at this time, I think the best data we've got is at the state level, and we don't have anything specific to our specific service area.
All right, thank you very much.
Thank you.
Dr. Senna, this is Mike at KWAT. Just to clarify here, you specialize in pulmonary care, is that correct?
Pulmonary and critical care medicine.
For Prairie Lakes?
For Prairie Lakes, yes, sir.
Okay. The governor today on her conference call, she was talking about the virus. She talked about the potential for a second or an even third wave of this. Based on anything that you've read or heard, is that at least a possibility, do you think?
In my line of work, in the critical care business, you prepare for the worst and hope for the best. And at this point, I think my best advice would be to prepare for a second wave. Historically speaking, that's what we seem to see. And based on the experts that are at state and federal levels, I don't have any unique knowledge to argue with what they're saying. As far as what I am trying to do in Prairie Lakes, we are preparing the best we can, learning from the coasts, and trying to implement some of the things that they're learning now. So we have that benefit. So that's kind of where we're at in terms of our preparation with this whole deal.
Thank you.
Thank you.
Would Chris be available for a question or two?
Hi, Mike.
Hey, Chris, how you doing?
Good.
Good. Say, just in regard to the zero-interest loan program, you mentioned that it's not going to be some magic bullet or anything, but based on the hardships that some of these businesses are facing now, how important will this be for them just to maybe survive and keep the doors open another month or two when they're really strapped for cash?
Yeah, great question, Mike, and good point. So that was the whole idea behind it, was to, if now it's June, July, or August, whatever that day ends up being, is that, this could be a bridge gap for them between now and when stimulus funds or SBA funds come around, that it buys them another month or two depending on their operational cost. So depending on the number of employees really determines your loan amount, and that could hopefully get people through a month or two and shorten up, the hardship for them. And it's open to pretty much any business. We've been talking internally as staff, and we can't think of one that wouldn't qualify. So, if you're in doubt, please fill out the application and send it in so we can take a look. We try to make it as easy as possible, and hopefully we get quick turnarounds and can get checks out the door, at least once a week, or if not more than that, to the companies applying.
As you talk to these business owners, Chris, some of them that have maybe closed or some that are still open, but they've seen their traffic decrease pretty substantially, how scared are they? What kind of things are you hearing from them?
Well, I mean, the unknown is scary for sure. The one thing that we're trying to provide is, here's some hope that we can get through this, and on the other side, everybody's committed to coming back stronger. That's what we wanted to come out with this program was, and other people such as the city and utilities and the people that have invested so far think the same way, is that this is hopefully a lifeline to get everybody through. Everybody, I think, is scared of the unknown. Business is hard generally, but you throw this on top of it, makes it even harder. So I think, as everybody said, we'll get through this together. We have a program that we put out pretty fast. If we need to tweak that in any way, shape, or form, we'd be open to that. But as of right now, we got 10 apps already today, and we just put it online this morning. So so far, it's been getting a lot of traction, and we see that probably picking up here.
Chris, question for you. Can you tell us who the partners are with that?
Yeah, so City of Watertown, Municipal Utilities, we've got Dakota Bank, First Premier Bank, Relia Bank, and then also the personal donation from T. Denny Sanford are the partners as of now. If anybody is interested in providing a donation to our revolving loan fund, you could reach me at chris@watertownworks.com or give me a call on my cell phone, 605-520-2500.
Mike Tanner?
2500.
Okay, I'm sorry, Chris. Can you give that phone number again?
Okay,
You recovered there.
605-520-2500.
Thank you.
Thank you.
All right, if there's no further questions, I'd like to thank everyone for joining us today. Mayor Karen, Dr. Senna, and Executive Director Chris Silken. Just a reminder, the food distribution is starting right now at 4 o'clock. Again, you're going to want to enter from Highway 81 and then go east on Arrow Avenue, and they'll direct you where to go to get to the Boys and Girls Club there. One thing I'd like to end on today, when I teach my DARE lessons, there's a phrase I always use at the end, and I'm going to use that here today. And I always say, be safe and be responsible. What I want everyone to do is be safe, protect yourselves and others by not taking any unnecessary risk which could cause exposure to COVID-19. And on the responsible piece, I'd like to ask everyone to be responsible because we all have an obligation during this time to take control of our actions and to reduce the exposure to COVID-19. So as I walk away today, I want to ask everyone to be safe and be responsible. Thank you.